the nose.
It's a complex structure and it really must be respected.
Your nose is out there. It's the first thing you see. It's the center point of your face.
There are potential for major complications when injecting the nose with filler.
The possibility of going blind from a non-surgical rhinoplasty.
Rhinoplasty is a very delicate surgery and it can easily be overdone.
It can also change people's lives.
You can get great results. Some of the happiest clients we have are rhinoplasty patients.
Ladies and gentlemen, welcome your hosts of Skinterviews, the expert series, George Scandalis and Nathan Strom.
Welcome. You said blue. No, you said blue. So I figured you said...
We said we were going to give a big shout out to Dr. Katie Belesny. We were going to wear scrubs tonight. And we were going to wear our blue scrubs.
You sent me an email and you said, let's wear scrubs to make Katie Belesny feel better. Dr. Katie Belesny, we should say. Okay, we're not that comfortable with our experts. And you said, wear the blue scrubs. I wear the blue scrubs.
the blue scrubs.
No, that's like an aqua blue, a light blue.
Well, should we say hello to our studio audience?
Well, I guess we have to now, but...
Hello, everybody!
Hi, everybody. Thank you for being here today. And for those of you that want to be at one of our next episodes live in our studio audience with everyone here today, please visit Skinterviews.world and go to the section to buy tickets to be part of our live studio audience here today. Well, I said here today like how many times there? Can you tell we're not professional? Because it's the fact that we fight on camera over what color is blue and what is not blue. So today's episode, though...
Well, a few things first.
What do you want to talk about now?
All you lovely ladies out there, we're getting a lot of messages.
Hold on.
And
what, the lovely men?
And lovely men as well.
Thank you.
Dr. Daria Hamra is happily married.
Yes. That goes for our producer who keeps flirting with him. Catherine, he's married with children. Okay? Stop it.
Another thing is, we've had a lot of requests for Dr. Scott Nicky's book.
Absolutely.
Beyond Soap.
Beyond Soap. It's a great book.
Where can they get it?
They can buy it on Amazon. And you know what I love about her book? It's available in a ton of different languages, so you can buy it anywhere. Because if you're a Skinterview world, you got to be ready for the whole world to read it. And she's not the only expert that has a book in our series. We've also got Dr. Doris Day, who's got, I think, 3 books out, and Dr. Anna Guanche, who's got her own book out. And maybe the rest of our experts are writing a book about their experience on Skinterviews, the expert series. I hope I'm in the book because I would really love to be just in anyone's book. If you want to write anything about me, even a bad comment, just go ahead and get on our social media at skin.terviews on Instagram, Facebook and LinkedIn. We're Skinterviews by Nathan and George. Of course, you can watch season 1 and season 2 if you want to get to know the life that led our experts to become who they are today and what they practice in medicine. Watch season 1, watch season 2. We also have one of our favorite things that we get to do, which is Skinterviews on location. We had to take a small pause with it because of COVID, but we are back on the road, going to clinics in a city near you, talking about treatments, featured skincare, getting to know the doctors, getting to know the teams. We are coming close to you. If we're ever in your city and you want to know, what do you got to do? Message us to find out. So simple. Are you ready for today's episode?
I'm very ready for this episode.
Okay. Well, this episode is all about the nose. And the nose is a very, very complex organ in our body. It does so many different things. Everything from smelling and breathing and humidifying the air we breathe, regulating temperature of the air around us. Some studies show that it even affects reproduction.
Really?
Yeah, because Nathan, if you smell good, then I'm like, hey, boo, you smell damn good. But if you smell bad, I'm like, Nathan, you stink. And most of the time, I love you to death, but you stink, buddy. Like, You sweat like a monster, man. We should do a whole episode on hyperhidrosis just for you. So the nose can be something of great adoration, but it can also be something of great criticism, or at least it can lead to some great criticism. But despite how vital it is to our everyday lives, people still want to go under the knife and change their nose because they don't like the way it looks. Now, nose jobs, or rhinoplasty as it's known medically, is not anything new. They've been doing them for a long time. They've gotten better over time. There's ways to do them without actually opening the nose now, from what I hear. We're going to learn all about that today from our surgeons. But there is another type of nose job that's coming out in the market, and it's gaining a lot of popularity, and it's called a
Liquid rhinoplasty.
a liquid rhinoplasty. So that is a non-surgical option. However, like the BBL, liquid rhinoplasties come with a lot of risk and should only be trusted in the hands of a professional with a lot of experience doing it. In fact, some of our experts that you're going to learn from today decide not to do this in their practice because they don't feel comfortable. Why? There's a small possibility that if something goes wrong and the right critical care is not handled immediately, you could go blind.
So, should we hear more from people who knows a lot about this subject matter?
Did you just make the cheesiest dad joke in the middle of my introduction?
I couldn't help myself.
All right, so let's go to those in the nose. Is that
Those are the nose.
those in the nose? We'll smell you later. Bye.
So the nose is really an architectural marvel. It's essentially this beautiful three-dimensional structure that covers a hole in the bony skeleton. You know, it delivers both form and function. It allows us to breathe and smell, and it also regulates both the temperature and the humidity of the air that we breathe.
Your nose is out there. It's the first thing you see. It's the center point of your face. So anything we're doing to the nose, whether it's surgery, non-surgery, it really has to be thought through carefully.
It's comprised of a series of buttresses and struts and supports made of bone and cartilage. You almost need an engineering degree to fully understand all the intricacies. Then on top of that, the whole thing is covered in skin on the outside and mucosa on the inside. It's a complex structure and it really must be respected.
When I think about rhinoplasty, I think about two things. There's the aesthetics of the nose, how your nose looks, how you want your nose to look. And then there's the functional part of your nose, the breathing. Are you able to breathe? What's going on with that?
I certainly do not perform surgical rhinoplasties, and I also leave the non-surgical rhinoplasties to our expert surgeons in our clinic. And so I am actually going to let the expert panel of surgeons on Skinterviews talk about surgical and non-surgical rhinoplasties.
So rhinoplasty, on the street also known as the nose job. Well, the nose job, again, like all of the things that we deal with and work with in plastic surgery, cosmetic surgery, they can be surgical, be non-surgical.
What is a non-surgical rhinoplasty? So the non-surgical nose job, or as some call it, the liquid rhinoplasty or liquid nose job, is the injection of hyaluronic acid filler into the nose to temporarily change its shape, and it's really become very popular, certainly on social media.
It has a very specific and narrow indication. You can do minimal contour changes of the nose. Let's say you want to hide a hump, or you want to elevate a tip droop a little bit or lengthen the tip. Let's say you have some irregularities on the dorsum of the nose, or the radix, which is the part that connects your forehead, or you want to create a little bit more of a roof on your dorsum of your nose. Let's say you have a flat nose and you want to give the illusion that your nose is not as flat. So you inject some fillers in the dorsum of the nose, and that puts a certain light reflection because you're basically elevating the bridge of the nose and give it a more pyramid shape. So you can basically camouflage irregularities and make small contour changes.
I think the nose, more than anything else, in terms of what we're dealing with in the face, is one of the most dynamic structures because of lighting. If you take a nose and you make even a very small, either a divot or a lump or anything in the nose, you really notice it. Because we walk around in light, whether we're in the office and it's lights above, outside in the sun, that reflecting, that glare, that shadow effect of the nose is very powerful. So we can use that to our advantage.
With injections, we can also improve the tip definition, we can support the tip, and even give it improved projection.
People use different types of fillers. Some last longer than others. The longer lasting fillers cannot be reversed and I feel are a little bit more risky. The hyaluronic acid based fillers are ideal for recontouring the nose. It brings joy to so many people. It's quick, 5 to 15 minutes, and the patient is in general thrilled with their new contour.
In fact, I had a patient who'd had several rhinoplasties who came to me very upset, had a small deficiency, and I've been treating her now probably once a year with very, very small amount of filler just on one side of her nose. It's 10 minutes, filler, she's good, she's happy. No surgery, nothing else. It works wonderfully and she's happy with it. So, I mean, these are the kind of places where we can use it. Great tool with great results.
So non-surgical treatments may make sense for those who have more mild concerns, like a small bump, for example, they want to camouflage. But the biggest benefit of a traditional nose job is its permanence, assuming, of course, that you're happy with the results. But non-surgical can be a way for people to get a preview of what a traditional rhinoplasty may look like without some of the expense and downtime of surgery.
So not everybody can afford plastic surgery. Filler is less expensive, and it's a great alternative if you have a shape that is amenable to filler.
The goal of a liquid rhinoplasty is actually to trick the brain a little bit. So if somebody comes in, they have a big dorsal hump on the back of their nose, we can do a reductive rhinoplasty to really shave that down, make it nice and smooth. But in a liquid rhino, we're actually adding volume both above and below that bump. We're camouflaging the bump while actually making the nose bigger. Now, our brain is a beautiful thing, right? It tends to hunt for imperfections of symmetry, and it absolutely loves clean lines.
Our goal is not to make it bigger. It's not to make it wider. It's to fill in those deficiencies to give you almost the illusion that that bump is no longer there. So when you look at that person on the side profile, that bump is no longer a bump, it's a smooth transition.
Think about architectural designs, right? From Victorian to Art Deco to modern. So even though we're making that nose bigger and we're elevating the radix or the takeoff of the nose, it becomes more pleasing to our eyes because we see a nice smooth contour.
And again, this is where the artistry, if it comes in, you don't want to put too much product. So a major bump on the back of your nose, you have to know the limits. Because you can't put too much filler above and below, because now you're going to bring the radix or the root of your nose out too far, and their nose is going to look ridiculous.
So it is very artistic, and rhinoplasty in general is all about art and aesthetics. But it's very important not to overdo it. What makes me nervous is when people do the non-surgical, which is the filler, the non-surgical rhinoplasty, and are not too familiar with the nasal anatomy, where I've seen complications that are very difficult to treat.
So liquid rhinoplasty is high risk, and only the most advanced expert, I think, with full emergency protocol, kits in office to manage complications should be doing it. In fact, in BC, where I practice, there was a high-profile case of a patient who sued the naturopath who injected her nose, leading to some alleged serious complications. And now, as of January 2021 here, naturopaths are banned from performing liquid nose jobs.
All injectors do not perform this procedure because it's highly technical. You need to have a knowledge of the anatomy and be an experienced injector. It is not something everyone can just pick up a needle and do, because it has risks involved with it.
There are potential for major complications when injecting the nose with filler. There's these major arteries located right in the midface, and so loss of blood supply to the skin on the face, or very rarely blindness, can occur. And we actually published 2 large review papers on the risks of blindness from filler, and the nose together was the most high-risk site.
The biggest fear that patients and injectors alike have is the possibility of going blind from a non-surgical rhinoplasty. A vascular event is a real risk, and that's why it's so important to go to somebody who knows what they're doing, knows the anatomy, and has safe injection technique.
Yeah, and it's such a scary complication to hear that, hey, actually, you're getting this treatment to make yourself look better and you could go blind. But it's important for people to know that filler can carry more serious risks. And yeah, this is an area that we've done a fair bit of research and published on. So the most catastrophic complication is vascular compromise, and that can be when a filler gets injected into a blood vessel, and that can reduce the circulation to either the skin, causing complications to the skin, lack of blood supply to the skin. You can get scarring or necrosis, or you can get lack of blood supply to the feeding blood vessels to the eye and cause blindness. And so these are very serious complications. Now, these risks are not common, and I will go into that, but I just want to preface this, we're talking about the nose, but the reality is that almost anywhere that filler is injected on the face does have some risk of getting into a blood vessel and causing complication.
The glabella and the nasal bridge are two of the most risky areas to inject for vessel occlusion. So one has to be very, very careful in choosing the individual who does this procedure. It should be someone who does it regularly, constantly, and not just trying it out for the first time on you.
The nose is very vascular. I mean, any person who's dabbled at all, whether beginner or advanced personnel with injections, knows that one of the biggest fearful complications is that of injecting into an artery or something of that nature, and the terrible sequelae that can happen.
The area is more risky because there is some vasculature that can be connected to the retrobulbar area. If you're an experienced injector, you will not come anywhere near the depth that you would need to have that occur. But then there are variances in vasculature, so we always warn our patients.
But yes, so the risk of blindness from filler is low. And we found in the 2 big review papers we did, 146 cases of blindness that were reported in the literature between 1906, so this is dating way back, and 2018. Now, of course, this is just what was published. So this number is actually likely a lot higher, but these were the cases that were actually published in the literature. Now, to put that in perspective, though, this is with over 5 million filler treatments being performed each year. So you can see that that risk is exceedingly low, but still important to be aware of.
The statistics on this are unclear. We do not have data from the last 5 or 7 years of someone having a vessel occlusion or blindness caused by nose reshaping, but historically it has happened. Most of the vessel occlusions that have happened due to fat transfers.
There were other things being injected. Paraffin's been injected over the years, silicone, other things. So hyaluronic acid and some of the other filler types that we have now were not being injected back in those days.
And so in the years past, there were fat transfers done to the glabellar area and the bridge of the nose, and those led to vessel occlusion. And there has been cases of vessel occlusion in the nasolabial fold, in the temporal area. So there are different parts of the face that this can happen, but an experienced injector will know what to look for and will know the depth of injection that they should do.
Which is why it's very important that all of the injectors are, very familiar and trained and experienced in and around that subject.
Before I do anything that is new to me, I take a course. I mean, everybody should. We learn from each other. We teach each other. For the most part, the cosmetic group of dermatologists and plastic surgeons are all very happy to teach each other and help each other because we don't want people looking weird. We don't want accidents to happen.
What's scary to many of us who are involved in this research is that as more and more of these pop-up Botox filler spas open up, and there's even these, active promotions, Groupons even to get people in for this discounted quick lunchtime injection, it demedicalizes the procedure and underplays this potential risk. And sometimes people are just not aware of the fact that this is a serious procedure. It should be done safely with a provider who is experienced, who understands complications, and that you trust to provide care. And there's a number of ways we can discuss how you can learn more about your provider and ways that they can prevent this complication.
You should be taking update courses if you want to add that. And you should also ask the person that you're going to how many they've done.
But even, degrees aside, your injector should be incredibly familiar with risks. So knowing, for instance, the high-risk areas and that injections have to be placed at specific depths. We know where those blood vessels are, and so what's higher risk, where should we be injecting? So really understanding and knowing the facial anatomy inside and out. And secondly, your injector should have the expertise to immediately recognize filler complications. They need to know what to look for, and importantly, be able to manage filler complications right away. And so many offices, I recommend having, a first aid kit or an emergency protocol where if a complication occurs, you're able to manage it immediately and in office.
It's one of those things where it could be great every time, but that one time the anatomy doesn't fit and somebody loses their vision or has necrosis, I'd want to kill myself. I would just feel so badly. So I'm just not up for doing it. And I certainly never take anything I do casually. And this is something I will get to and maybe do a lot of at some point, but I'm just not there yet in my comfort zone. And I think it's always good to push out of your comfort zone. But when I look at the anatomy of this area and all the things that could go wrong, it just makes me very hesitant to do it.
So in this day and age too, with Instagram and social media, these procedures are commonly put up there, and it makes them look incredibly easy and people feel comfortable. Like, oh, look at that. They're, injecting a nose, boom, boom, and look at the amazing before and after. But I think for those who are interested in getting Botox and fillers, you need to understand they can have complications. And so seeing an experienced provider, even a specialist like a dermatologist, plastic surgeon, is important.
I'm not usually the first adopter of new technology. I wait for everyone else to figure it out, learn all the things that could go wrong. And once it's there and I feel comfortable, I learn from everyone else's mistake and then I just make it better.
Understanding and knowing that the person you're seeing, this isn't just like a side thing that they're doing. This is their full-time job. I saw this Instagram story the other day that said, would you want to go to a part-time heart surgeon to do your transplant? No, you want to choose your full-time injector wisely. Someone who does this regularly, understands facial anatomy, understands complications. It's not something they, do the odd day in their basement or at a spa. This is what they are committed to researching, understanding the evidence, learning about, and providing the best outcomes for patients.
The same thing can occur from injecting the lips, but it's very remote, more likely from the nasolabial fold area. And that is connected directly to the internal arterial system, the deep nasolabial corner. And so again, a knowledge of the anatomy and understanding of what it feels like to inject into a vessel versus injecting into tissue is very important. And some of this just comes with experience and time.
So even though I'm talking about all the scary things, injections of filler are most commonly safe. And if you find the right experienced injector, you can find someone who's able to, deliver these beautiful, natural, evidence-based results that are safe. But I think it is important to everyone to think about the fact that there are complications. See somebody you trust.
One thing I would say about when you're looking for a nose job is people will charge what the market will bear. So if they're talented, their prices will be higher. And that is very standard in the cosmetic world. If a plastic surgeon is reputable and has an amazing talent, he will be able to charge more and will charge more. So do not bargain shop for your nose job, ever. I think that applies to all of plastic surgery and even cosmetic dermatology. The lower price you pay directly correlates with the quality of work that you get.
Trusting the practitioner you see is so important. I think not only to achieve the best outcomes with your treatment, but also to reduce the chance of complications. And when you see somebody who has expertise, maybe they have specialized fellowship training, I think it's worthwhile in some respects to find somebody that has the credentials, the expertise that they have. You can even meet with them for a consultation to make sure you feel comfortable proceeding with a proposed treatment plan. And so I think it's a lot about trust, understanding what expertise they have to be doing providing the services that they are.
Within the surgical options, you can do a open rhinoplasty, you can do a closed rhinoplasty, or you can do what's called now, it's a new thing, preservation rhinoplasty, which is a type of closed rhinoplasty.
So as I mentioned, with a liquid rhinoplasty, you're actually making the nose a little bit bigger in order to trick the eye. With the surgical rhinoplasty, we have a lot more control to be able to reduce the size, really adjust the finer points of the cartilage and the bone and the soft tissue in order to achieve a really nice smooth contour.
You know, just like any type of facial skeletal surgery is permanent. For example, fixing someone with an underbite or overbite, which is a growth discrepancy of the upper versus lower jaw. You know, you basically cut the bones, reposition them, fix them in more aesthetic position that are also functional. That's also permanent. So anytime you deal with bone and cartilage, which is what rhinoplasty is mainly made of, and the skin is just like draping, that's more permanent. Anytime the more soft tissue component you have to the aspect of a surgery, for example, in a facelift, those things are more affected by the aging process and by gravity. As it says, soft tissue, it's soft. It moves more easily as opposed to bone and cartilage.
Let's talk about downtime. Now with a non-surgical rhinoplasty, there really isn't any. Maybe a little bit of a bruise or something like that, but we're just essentially adding clear jelly and you can do this on your lunch hour. With a surgical rhinoplasty, a little bit of a different story. You've got swelling. Swelling can last a long time. You know, the majority of the swelling, I talk about it being an inverse relation. The majority of the swelling, 90% is gone within the first couple of months, but that last little bit, that tail end of the swelling can take up to a year.
So an in-depth discussion with a patient potentially undergoing a rhinoplasty. After we detail what the plan is, we detail what the expectations are we going to meet it? The very next thing I tell them is that in our office, you will have before and after pictures of your nose on multiple angles. We will not use our final picture as a comparison until 1 year. 1 year. So, and that could be whether at 6 months you have the best result, you're super happy. I still don't feel comfortable using that as your tremendous result. It takes 1 year. The nose, the structure, cartilaginous, soft tissue, bone, it takes a year for it to remodel, for it to settle, to get you that final result. And at 1 year, in most cases, some shorter, some longer, at 1 year, it's kind of what you have is what you have. But it takes that long.
So with surgical rhinoplasty, patience really is a virtue. Plastic surgeons, we have a knack for saying, give it time, it needs to settle. And that is true in most of what we do. But in surgical rhinoplasty, it's of paramount importance.
The one thing I don't love about surgical rhinoplasty, unless it's absolutely necessary, is that it changes. When it's healing, sometimes the scar tissue pulls the tip to one side, from one side to the other. Sometimes the collagen strut becomes very apparent through the skin because sometimes to make the nose more perky, some cartilage is borrowed from the ear or from the side of the nose and it's creating a strut. And in the beginning, it looks amazing. And as it heals, some fibrosis happens and you can actually see the strut through the skin. And actually, when I do nose reshaping, a lot of times people have already had a nose job and I'm trying to correct and contour around that cartilage strut that's been placed. Or they have nostril asymmetry because the scar tissue has pulled one nostril higher and more open than another. So there are things we could do with filler that you actually can't do with surgery.
Now, recovery for a rhinoplasty, a lot of patients come in and they're like, wow, rhinoplasty, I'm going to be down and out for so long. A typical rhinoplasty done in a very atraumatic, delicate technique, the downtime is really, really minimal. I thought, having a rhinoplasty, especially if we're doing, osteotomies in the bone and things like this, patients often, they're wearing a splint for a week, a couple of stitches in various places, mostly on the bottom of your nose. The only thing they complain of is a little bit of a fullness in their nose, a bit of a headache sometimes, tenderness if they're actually pushing their nose, but otherwise they function quite well. I'm actually surprised by how little of a discomfort downtime they have.
I have a lot of patients that wait forever to finally have the rhinoplasty done because they assume it hurts. And it's crazy. All the information is out there, it's online. You just can listen to someone's vlog that went or described or the journey of the rhinoplasty recovery. All of them will tell you the same thing. I had a rhinoplasty done. I remember the next day, my wife asked me, hey, do you want your pain pills. I'm like, pain pills? What for? He's like, well, you just had rhinoplasty yesterday. I'm like, well, it doesn't hurt, so I don't need pain pills. I was actually surprised myself, and I knew about it, but it surprised me nevertheless.
But the downtime, again, probably in the same range as the facelift patient. You need a couple of weeks, right? You're splinted usually. Some patients, depending on the surgery, have packing in their nose for a few days. But after about 2 weeks, you're kind of at that, again, socially presentable phase.
The recovery is actually pretty quick. Like after a week, you can already see the results and show off your new nose. Yes, there's going to be swelling and some irregularities here and there. They're really minimal. So if you want to nitpick, you're going to have to wait for 6 months, sometimes up to a year, for things to settle. And that depends on how you recover and how the tissue swelling slowly fades away. And that has to do with your own physiology, with your anatomy, and the extent of work that was done. Not every rhinoplasty is the same. It's like building a house. Why are you building a 10,000 square foot house, or are you building a 3,000 square foot house? How much work is required? How long was the surgery? All those aspects play a role in the recovery process, and until you see the final result. But again, after a week, you can already benefit from some of the results, which to me makes the recovery for something that's in the middle of your face and can be really transformational, a no-brainer.
Rhinoplasty is a very delicate surgery, and it can easily be overdone. Stepping too far into ablative portions of rhinoplasties, again, taking too much bone, taking too much cartilage, it's a real hard one to come back from. Real difficult.
All the things that can go wrong in a rhinoplasty, I mean, geez, we can do a whole episode just on that. You can have an upturned nose, a downturned nose. You can have a polybeak deformity, an alar notch. You can have an open roof deformity, saddle nose, pinch tip, asymmetry. I could go on.
A rhinoplasty is a transformation. You can only transform a nose from a given shape to another shape. There's no absolute change. You can't copy paste someone else's nose, because when you do rhinoplasty surgery, you change the shape of the nose, starting with what the patient comes in with, okay? For example, if you have a large and wide nose that has thick skin and very thin cartilages, you can't make dramatic changes to that, because no matter what you do, once you pull and drape the skin over, it will hide everything, all the work that you did. So the changes are minuscule. And so those expectations have to be set from the get-go. And if you try to do too much as a surgeon, you might dig yourself and the patient a deep hole where no one can crawl out of, and you might need multiple reconstructive surgeries just to get to the point you started off.
There's things that we can look at as rhinoplasty surgeons, and I can theorize about what happened. They took too much bone, they took too much cartilage, they overdid this or that. The common person doesn't know, but they surely know when they look at that nose that something's not right. I mean, they'll look and go, ooh, this is overdone.
It's very disappointing and disheartening when it goes wrong, just because it's the one part of your body you can't hide. So it's always exposed. And it's the first thing you see when you look in the mirror, because it sticks out. Small asymmetries can be picked up and can bother someone and throw someone off or draw the attention. So it's very obvious. So that's why it's frustrating, because you can't take your mind off of it. It occupies your mind constantly and could be very distressful just mentally. On top of it, functionally, it could create breathing issues if it's not done right. Because let's not forget, the primary reason why we have a nose is for breathing purposes. And that could be even adding to the frustration. So those are the two things. And so what I do, which is I was lucky enough to have great mentors that really instilled in me the values that I, live by and practice by, is that I never leave the operating room until I know that I have done the best possible job that I could have done. which means if there's any revisions to be done, I do it right then and there. Okay? There's no such thing when you look at the nose, you go like, yeah, I guess it's good enough, let's wrap it up. Okay? So when I do rhinoplasties, I don't do any other surgery after that because I don't want to be pressured by time, the limitation of time that I have to wrap it up. Because sometimes I just stare and look at the nose for literally half an hour. Look at all angles. Sometimes I have to take my eyes off and then go back to it. And when something just doesn't look right, and I don't know what doesn't look right yet, I will stop. I will take a timeout until I have identified why the nose doesn't look right. And that's the artistic thing. That's I feel I owe that to the patient because I would not want to put my own patient through a revision. And even if I have to, I want it to be a small revision, okay? I don't want it to be a major reconstruction. I do revision rhinoplasty, and some of the cases that come to me end up being major reconstruction. And it's sad because I know it could have been prevented if the surgeon knew his or her limitations and was familiar with all the aspects of rhinoplasty, of the techniques, in order to avoid that. And for that reason, I really take it that responsibility to heart, and I never leave the operating room until I know it's perfect.
There's a lot of art to rhinoplasty, and I think it would serve patients well to do some research and see a few different physicians because there's a sort of a I don't know what is the French word I'm looking for. Finesse, or just sometimes people have that eye and it may be not what you like.
You know, a lot of us that are like expert rhinoplasty surgeons, we don't measure much anymore. We know when the nose looks good or not, and that's called experience. You develop an eye for it. So you have to couple that with good ears, which is listening to what is it the patient wants. And with imaging technology, we can show the patients what we're talking about and what they can expect to at least create a frame for their expectations. Now, within that frame, it could be here, there, or there, or there, but as long as they're okay with anything that's within that frame, then you could call it a success.
So what does the eye like? We like a straight nasal dorsum, which narrows at the midpoint, coming down to a perfectly proportioned tip with a super tip break on the side profile.
The trend in noses today is like a really perfectly smooth nose, which I think is a key giveaway to a done nose. And that's not a look that I think helps enhance most people's natural beauty. So I like to work around noses, not on noses, and there's very few noses that I see that would really benefit from being sculpted any more than they are. Honestly, a nose should just kind of match your face, not stand out in any way. And if you're really noticing the nose, then I think that there's something wrong with the work. It should be almost like it's right there in the middle of your face, but you barely notice it. It's just kind of there.
The tip, we think of it like Goldilocks, right? You don't want it too big, you don't want too small. You don't want too high, you don't want too low. You don't want too narrow, you don't want too wide. You don't want too boxy, you don't want too pinched. It has to be just right.
I think that trends are getting away from that, standard nose shape that everyone should have. We used to have the ski jump nose, and we had the Roman nose, and all the different trends. And even plastic surgeons would have a style of nose that they would do that would be their signature. So how crazy is that? Like, we should have a nose that's our signature, that fits our faces, not what the plastic surgeon's signature is on it. And so now we are seeing that we're moving away from that ski jump nose where there's a lot of nostril show. We're getting away from everyone having the same nose, and we're harmonizing with our faces. With filler, there is a trend of having a boop nose, a little bump on the tip of the nose to give like a cuteness to it. I compare it to like the Cindy Lou Who nose, but not quite as exaggerated. And I'm okay with it because people like it, it's cute, and it won't be forever. If they decide the trend's gone and they don't want it anymore, it will fade, or we can dissolve it overnight.
It's very important to manage patients' expectations, especially someone that comes with a picture of a nose that has been trending, because my question is, are you going to like this nose in 10 years from now? I mean, if right now I'm wearing this jacket, 10 years from now, it might not be trendy. Maybe like a jacket that is really wide and large and is really like baggy feeling, that's a trend. Then I might not like it because, ultimately we like trends, and you don't want to apply a trend to your face, something that's not really reversible. You have to be very careful.
I also like the shape of noses. I like when noses are a little bit off. I don't think, a plastic surgeon once said in a lecture that a good nose is perfect. And some of the things we do to try to make noses perfect, I don't think necessarily complements or makes the face so much better. So I don't think as many noses need to be treated as we're treating.
Your nose should fit harmoniously within your face, not based on a trend.
I definitely think people should embrace their originality. And as I've said before, I love men with big noses. I don't want a guy with a tiny nose. I don't know why. It's personal preference. But if you look around and you see celebrity men, a lot of them do have good sized noses. So it's not really the pressure to have that perfect little straight nose like women feel they should have. And so, in fact, sometimes you can take that big Roman nose or take that bump away, and then all of a sudden the guy just doesn't look the same. The last thing you want is a guy with a ski jump nose, right? Sorry, guys who have ski jump noses. But I'm just saying there definitely is a different aesthetic for men and women, and we are starting to really understand and embrace that.
Let's take a minute and talk about ethnicity. It's so important to have an understanding and a respect for the differences between different ethnicities. Or in fact, research indicates that the differences are actually a result of adaptations from different environments and climates. So for example, a nose with a narrow bridge, prevalent amongst Europeans, is a genetic adaptation to a dry, cold environment. I thought that was pretty cool.
It's a cultural thing, like it's a geographic thing. In Turkey, for example, the trend is to create these narrow bridges with these very pointy tips. So it doesn't matter really what the trend is. Ultimately, the patient has to like her or his nose, right?
It can be a great surgery so long as, again, your expectations and the plan is reasonable. Because you can get great results. Some of the happiest clients we have are rhinoplasty patients.
It can also change people's lives because, sometimes people are born with a nose that the shape they don't like. And again, it's all about empowering you to feel good about yourself and not apologizing for doing something that makes you feel good about you.
Honestly?
I told you I was going to change.
No, you said we should change.
No, I said I would change.
You said go put on the blue one.
Look, we did our best for Dr. Katie Belesner.
Your best is just not good enough. Is it?
My best.
We want to thank our live studio audience for being here today. Thank you very much. Yes, we love you too. You are adorable. Thank you very much. And we want to hear from you, the audience at home. Make sure to get on our social media, @skin.terviews on Instagram. Send us your comments, questions, what you like about the episode, which color blue you like more. Huh? Which one? And of course, follow us on Facebook and LinkedIn. Skinterviews by Nathan and George. And where else? Where's the main hub?
Skinterviews.world, baby!
And apply to be in our next live studio audience. All you gotta do is go down to the section where it says buy tickets to be in the live studio audience. Come be here with us today. Get to know us up close and personal. Of course, watch season 1, season 2 of Skinterviews by Nathan and George and get to know our doctors personally. Get to know the experts on the show even better. Of course, you can see when we go to visit clinics with Skinterviews on location. And today we learned all about the nose. You smell good.
Thank you.
You smell good today. It's actually kind of crazy that we're dressed opposite because next episode coming up on Skinterviews, the Expert Series, is all about balance and symmetry.
Yes.
Maybe we wouldn't look good if we were wearing the same blue. Maybe we look, hold on, I gotta stand on my toes. Maybe we look better like this, right? What do you think? Yeah?
Yeah, I think.
All right. We'll see everybody on the next episode of Skinterviews, the Expert Series. I'm gonna wear high heels for the next one, I think, just so I can be this tall. What do you think? Should we do it? I don't think I could walk long enough in it. Take care, everyone. Thank you for being here today. Bye-bye, everybody.
Bye-bye.
Take care.
Take care.
See you, buddy.